Lipitor is indicated as an adjunct to diet for reduction of elevated total cholesterol, total C, LDL-cholesterol, LDL-C, apolipoprotein B and triglycerides in adults, adolescents, and children aged 10 years or older with primary hypercholesterolaemia, including familial hypercholesterolaemia, heterozygous variant, or combined mixed hyperlipidaemia, when response to diet and other nonpharmacological measures is inadequate. Lipitor is also indicated to reduce total C and LDL-C in adults with homozygous familial hypercholesterolaemia as an adjunct to other lipid-lowering treatments, or if such treatments are unavailable. Prevention of cardiovascular events in adult patients estimated to have a high risk for a first cardiovascular event as an adjunct to correction of other risk factors. How to use? The patient should be placed on a standard cholesterol-lowering diet before receiving Lipitor and should continue on this diet during treatment with Lipitor. The dose should be individualized according to baseline LDL-C level, the goal of therapy, and patient response. The usual starting dose is 10 mg once a day. Adjustment of dose should be made at intervals of 4 weeks or more. The maximum dose is 80 mg once a day. Primary hypercholesterolemia and combined mixed hyperlipidaemia. The majority of patients are controlled with Lipitor 10 mg once a day. A therapeutic response is evident within 2 weeks, and the maximum therapeutic response is usually achieved within 4 weeks. The response is maintained during chronic therapy. Lipitor is for oral administration. Each daily dose of atorvastatin is given all at once and may be given at any time of day, with or without food. Heterozygous familial hypercholesterolemia. Patients should be started with Lipitor 10 mg daily. Dosage should be individualized and adjusted every 4 weeks to 40 mg daily. Thereafter, either the dose may be increased to a maximum of 80 mg daily, or a bile acid secrescent may be combined with 40 mg atorvastatin once daily. Homozygous familial hypercholesterolemia. Only limited data are available. The dose of atorvastatin in patients with homozygous familial hypercholesterolemia is 10 to 80 mg daily. Atorvastatin should be used as an adjunct to other lipid-lowering treatments if these patients or if such treatments are unavailable. Prevention of cardiovascular disease. In the primary prevention trial, the dose was 10 mg per day. High doses may be necessary in order to attain LDL cholesterol levels according to current guidelines. Hypercholesterolemia. Pediatric use should only be carried out by physicians experienced in the treatment of pediatric hyperlipidemia, and patients should be re-evaluated on a regular basis to assess progress. For patients with homozygous familial hypercholesterolemia aged 10 years and above, the recommended starting dose of atorvastatin is 10 mg per day. The dose may be increased to 80 mg daily according to the response and tolerability. Dosage should be individualized according to the recommended goal of therapy. Adjustments should be made at intervals of 4 weeks or more. The dose titration to 80 mg daily is supported by study data in adults and by limited clinical data from studies in children with homozygous familial hypercholesterolemia. There are limited safety and efficacy data available in children with homozygous familial hypercholesterolemia between 6 to 10 years of age, derived from open-label studies. Atorvastatin is not indicated in the treatment of patients below the age of 10 years. Other pharmaceutical forms' strength might be more appropriate for this population. Contraindications. Lipitor is contraindicated in patients with hypersensitivity to the active substance or to any of the excipients, with active liver disease or unexplained persistent elevations of serum transaminases exceeding 3 times the upper limit of normal, during pregnancy, while breastfeeding, and in women of childbearing potential not using appropriate contraceptive measures. Treated with the hepatitis C antivirals glycopyrrole, pibrentisfer. Warnings. You should not take Lipitor if you are pregnant or breastfeeding, if you have liver disease, or if you have had an allergic reaction to Lipitor in the past. Stop taking Lipitor and tell a doctor right away if you become pregnant. Serious drug interactions can occur when certain medicines are used together with Lipitor. Tell each of your healthcare providers about all medicines you use now and any medicines you start or stop using. Atorvastatin can cause a condition that results in the breakdown of skeletal muscle tissue, which can lead to kidney failure. Call a doctor right away if you have unexplained muscle pain, tiredness, or weakness, especially if you also have fever, unusual tiredness, or dark cold urine. Avoid eating foods that are high in fat or cholesterol. Lipitor will not be as effective in lowering your cholesterol if you do not follow a cholesterol-loving diet plan. Lipitor starts to work in about 2 weeks. Lipitor side effects. Get emergency medical help if you have signs of an allergic reaction to Lipitor, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. In rare cases, Lipitor can cause a condition that results in the breakdown of skeletal muscle tissue, leading to kidney failure. Call a doctor right away if you have unexplained muscle pain, tiredness, or weakness, especially if you also have fever, unusual tiredness, and dark cold urine. Also call a doctor at once if you have muscle weakness in your hips, shoulders, neck, and back. trouble lifting your arms, trouble climbing or standing, upper stomach pain, weakness, tight feeling, loss of appetite, dark urine, yellowing of the skin or eyes, signs of liver problems, or little or no urination, swelling in your feet or ankles, feeling tight or short of breath, signs of kidney problems. Common repeated side effects may include joint pain, stuffy nose, sore throat, diarrhea, or pain in your arms or legs.